Hello everyone, here we are going to cover grading and staging of cancer. You usually get a short question either on grading or on staging or both of them, but you never get long question on that. So short or very short question on them. So let's start. It's a small topic, grading and staging of cancer. So you can see we are starting the topic, that is grading and staging of cancer. So first I will let you know the introduction, why grading and staging is important, what is grading, what is staging, and one of the important system of staging, that is TNM staging, we will see in detail. Okay, so grading and staging are two different things. Many students have confusion or misconception. They think that grading and staging is one and the same thing. We divide the cancer into 4 grades, 1, 2, 3, 4. We divide the cancer into 4 stages, 1, 2, 3, 4, but they are different things. So let me start with the introduction. What do you mean by grading and what do you mean by staging? Both of them are necessary to predict the prognosis of the cancer, to predict the tumor behavior, the prognosis of the tumor, the prognosis of the cancer, and to guide the therapy, grading as well as staging. So grade 1 and stage 1 tumors have favorable prognosis, good prognosis, and grade 4 and stage 4 cancer have poor prognosis. So they are required to predict the prognosis, and stage wise and grade wise the treatment can be different. So they are required for two purposes. Number 1, to predict the prognosis of the tumor or cancer, and number 2, to guide the therapy, because different stages and different grades can have different treatment therapies options available for them. And grade 1 and stage 1 always have better prognosis, good prognosis, as compared to grade 4 or stage 4. So what do you mean by grading and what do you mean by staging now? Grading is the gross and microscopic appearance of a cancer based on the degree of differentiation of the tumor. I will let you know what is degree of differentiation. And staging is the extent of spread of the tumor within one patient. So let me explain you in two diagrams. For example, the patient is having a cancer in the stomach. For example, this is the gastric carcinoma in a patient. There is a patient having gastric carcinoma here. Let me draw the tumor here. So this is the tumor I'm drawing here, and this is the tumor I'm drawing here. So for example, this is the normal cells of the stomach. These are the normal, the blue one are the normal cells and the red one is the cancer cell. So I have to see the degree of differentiation. The tumor cell, how much they resemble the normal cell. That is the resemblance, the extent of the resemblance is known as differentiation. So how much the tumor is looking like the normal or how it is different from the normal, that will decide the grade. So for looking to it, we require microscope. So grading is always done by pathologist. It is always done by pathologist. It is based on the microscopic appearance. Microscopic appearance of the cancer cell. The red cell, how much they resemble the blue cell. I mean the tumor cell, the red cell is the tumor cell. How much they resemble the normal cell. The percentage of the resemblance or the percentage of difference. For example, 50% are resembling, 50% are different, for example. So this is the grading. I will tell you the details. This is grading. And what is staging? Now here you can see the tumor. This tumor can show the metastasis in multiple organs. The multiple secondaries are formed. So the extent to which it is spread it to the lymph nodes and spread it to other organs. The extent to which the spread of the tumor is there. We are looking the spread, how much the tumor is spreaded in the entire body, and that decides the stage. Staging is regarding the spread. You can learn S for S. Staging is regarding the spread of the tumor, and grading is regarding the microscopic resemblance of the tumor cell with the normal cell. I hope you are getting the 2 points. What is grading? What is staging? So grading is done by the pathologist because it requires the microscopic appearance. Microscopic appearance is done only by pathologist. Staging is the spread of the tumor. How much the tumor is spread in the entire body. We predict it with various tests like the PET CT scan. So it is done by the clinician. It is done by the clinician. And this one is done by the pathologist. I hope you are getting what is grading and what is staging. What is grading and what is staging? Grading is microscopic appearance, microscopic resemblance of the tumor cell with the adjacent cell. That is grading. And what is staging? Staging is the spread of the tumor in entire body. How much? The extent of the spread of the tumor. Grading is done by pathologist. Staging is done by the clinician. I hope you got the basics. So same thing is written in front of you. That is the introduction. With this introduction, I told you the grading is done on pathological basis and the staging is done on clinical ground. So this one is done by pathologists. This one is done by the clinicians. Now we will see the details of both of them one by one. Let's start with grading. I told you it is the gross and microscopic degree of differentiation of the tumor cell from the adjacent cell. Now you can see in this diagram the pink cells. Can you see the pink color cells? These are the normal cells of that tissue. For example, it is breast. So the pink cells are the normal breast cell. For example, it is stomach. So pink cells are the normal stomach cells. For example, it is brain. So pink cells are normal brain cell. So whatever tissue it is, in which organ the tumor it is that, the pink cell are the normal cell of that organ. I hope you are getting it. What are the blue cells? The blue cells are the cancer cell. Now, please, microscopically, you see the cancer cell, how much they resemble the normal cell, or it is different or it is resembling. Tell me the percentage. So out of total 100 cancer cell, only 25% are anaplastic. Anaplastic means they are different, and 75% are still resembling. It is known as grade 1 tumor. In grade 1 tumor, the 75% of the cancer cell, they resemble the normal cell. 25% are anaplastic. Anaplastic means they are different. It is known as grade 1. So in grade 1, 75% are resembling and 25% are anaplastic. In grade 2, 50% resemble and 50% are anaplastic. 50% resemble with the normal cells, the pink cells, and 50% of them are not resembling. They are anaplastic. In grade 3, 75%, 25% are resembling and 75% are not resembling. They are anaplastic. And in grade 4, more than 75% are anaplastic and less than 25% are resembling. So that is grade 4. So we have 4 grades: grade 1, grade 2, grade 3, grade 4. This grading system is known as border grading. So basically, in a group of cancer cell, have a look here. Have a look here. So for example, I'm having 100. We talk in terms of percentage. That's why I'm saying 100. For example, I'm having 100 cancer cell. You can see here. So we talk in terms of percentage. Out of the 100 cancer cell, how many of them are resembling the normal cell and how many of them are different from the normal cell? If 75% are resembling and 25% are anaplastic, anaplastic means different, it is known as grade 1. If 50-50, 50% are resembling and 50% are anaplastic, it is grade 2. In grade 3, only 25% are resembling, but 75% are different. It is grade 3. And in grade 4, maximum are different, although all 100 are different. Means more than 75% are anaplastic, it is grade 4. This is border grading system. That depends on the microscopy. We cannot decide the grading without microscope. So you have to put the slide of the cancer cell under microscope, in which you can judge a percentage, how much tumor cells are resembling the normal cell or they are anaplastic from the normal cell. So based on that percentage, we decide the grade of the tumor. Grade 1, grade 2, grade 3, grade 4. Grade 1 is known as well differentiated tumor. Grade 2 is moderately differentiated. Grade 3 is also moderately differentiated, and grade 4 is poorly differentiated tumor. So you have to understand the grading. It is based on the resemblance of the tumor cell with that of normal cell, the percentage of the resemblance of the tumor cell. So for example, there is a breast cancer in a female. She's a female and she's having the breast cancer. So this is red cells is the breast cancer cell, and the blue cells are the normal cells of the breast. So you have to tell me in the tumor how much percentage of the red cell are resembling the blue cell and how much percentage is not resembling, that is the anaplastic. Based on that, we can decide whether the tumor is grade 1, grade 2, grade 3 and grade 4. The treatment of the different grades can be different and the prognosis is definitely different. Grade 1 is having a good prognosis, grade 4 is having a poor prognosis. So based on which we can do the grading. Now coming on the staging. What do you mean by staging? Staging is the extent of spread of the tumor within the patient. Now this is the tumor. Again, let's talk the same. This is a breast cancer in a lady, in a patient, and it is spreaded to multiple organs. The metastasis is there. So how much it is spread? For that we have to do the clinical examination, investigation, radiological examination, based on which we will do the staging. Staging is done by the clinician. There are two important systems of staging, TNM and AJC. TNM is tumor size, nodal status and metastasis, TNM, that I will tell you in detail. And second is American Joint Committee, AGC, that we will not see in detail. So out of the two systems, we will see TNM staging system in detail. What is the full form of TNM? T means tumor size, N means nodal status, and M whether metastasis, M for metastasis, whether metastasis is present or not. So let's talk about the breast cancer. So for example, there is a patient coming in my clinic. There is a lady who is having a mass in the breast. So first I will judge the T for that lady. T. What is T? There are 4 options of T. Is it T1, T2, T3 or T4? If the tumor, I will do a mammography and I will see the tumor. If the tumor is less than 2 centimeter, it's T1. If it is 2 to 5 centimeter, it's T2. If it is more than 5 centimeter, it's T3. You see here it's less than 2 centimeter. Here 2 to 5 centimeter. Here more than 5 centimeter. So that's T3. And if whatever is the size of tumor, but if it is infiltrating the pectoralis muscle, ribs, and if it is infiltrating the skin, either downwards or upwards, it is T4. T4 is extending to the skin or the chest wall, it is T4. Whatever is the size doesn't matter. So decide the T for that person. T for that person. Now come on the N. Again, there are four possibilities. No lymph nodes are involved, we will say N0. No lymph nodes are involved, there is no T0, there is N0. Okay. So if no lymph nodes are involved, there is N0. There is a possibility that the lady is having the cancer, but lymph nodes are not involved. If only axillary lymph nodes are involved, but they are movable, it's N1. If axillary lymph nodes are involved, but they are fixed now, it's N2. If along with the axillary, supra and infraclavicular lymph nodes are also involved, it's N3. So we have to see which lymph nodes are involved and decide the N for that lady. And then we have to decide the M. For doing the M, we have to do the PET-CT. Do the PET-CT and see only two options. Metastasis is absent or present. If no metastasis, the tumor is confined only to the breast, say it is M0. And if it is spread to one organ, maybe liver, bone, brain, or any of the organ or multiple organs, it's M1. So M0 or M1. So in M, we have only two options. So first, whenever a lady is coming to my clinic having any cancer, for example, the lady is coming with a complaint of the breast cancer. So this is a rough sketch diagram, line diagram of a lady having the breast cancer. Okay, so let's draw a breast cancer here. So I have to decide the staging. For staging, I cannot decide. There are four stages. Stage 1, 2, 3, 4. I will come on that. How I will decide the stage. For that, I have to judge three things. First decide the T, decide the N, and decide the M for that lady. In the T, I'm having four options: T1, T2, T3, T4. If the tumor, I will do a mammography and see if the tumor is less than 2 cm, it's T1. If it is 2 to 5 cm, it's T2. If it is more than 5 cm, it's T3. But if it is involving the skin or the chest wall or the ribs, it is T4, whatever is the size. Then I will decide the N. In the N, I'm having four options: N0, N1, N2, N3. If no lymph nodes are involved, it's N0. If along with the breast cancer, axillary lymph nodes are involved here, but they are movable, it's N1. If they are fixed, axillary lymph nodes, it's N2. Along with the axillary, if the supraclavicular and infraclavicular, supra and infraclavicular lymph nodes are also involved, it's N3. So that is the N. And do a PET-CT and see whether METS is absent, M0, or METS is present, M1. So in the PET-CT, you will come to know that. So decide, now there are various combinations. Maybe it's T1, N0, M0. Maybe T2, N1, M0. So various combinations are possible. So first have a look on the T, N and M, and then decide the stage. Can you see here? Can you see here the tumor is very small, less than 2 cm. Here it is 2 to 5 cm. Here it is more than 5 cm maybe. Okay. And here whatever it is involving and it is metastatic basically. So we have to decide the stage. There are four stages: stage 1, 2, 3, 4. In stage 1, it is T1. But no nodes involved, no metastasis. And tumor is less than 2 cm. That is T is 1, but N is 0, M is 0. We call it stage 1, the best prognosis, stage 1 tumor. In stage 2, T can be 1 or 2. N can be 1 or 0, but there is no METs. So T can be 1 or 2, N can be 0 or 1, but there are no METs. In stage 3, whatever is the T, whatever is the N, but M is 0. Basically, N is 2 to 3 here, but M is 0. There is no METs. In stage 4, metastasis is always present. Whatever T doesn't matter, whatever N doesn't matter, but it is metastatic. M is always 1. And there is no cure for metastatic stage 4 tumor. There is no cure available till date. It is under research, but it is no cure available till date. Stage 1 having the best prognosis, the 5-year survival is 84. So out of the 100 ladies, 84 will survive after 5 years. In stage 2, the 5-year survival is 71. So out of the 100 ladies, 71 will survive after 5 years. In stage 3, the 5-year survival is 48. Nearly 50%. So nearly 50% of the ladies will survive after 50 years. But in stage 4, only 18 ladies will survive out of the 100 after 5 years. So look at the 5-year survival rate if you want to know the prognosis. So that is the staging. I hope you got it. So I hope you got how to decide the grade and how to decide the stage. Here also we have 1, 2, 3, 4 grade. Here also we have 1, 2, 3, 4 stage. For grading, I told you border system in which we decide the grade based on the percentage of anaplasia. And here I told you TNM, in which we decide the stage based on the T, N and M combination. So that's all about it. I hope you got it. You get a short question on that or very short question. So have a look on the very short questions and MCQs of this topic given in your notes section. Thank you so much.